Hello, this presentation is on the clinical integration of an EHR or electronic health record at Central Coast Medical Systems. So on the Central Coast, we have a current population of 108,470 people. The facility is a 300-bed hospital, and we need to implement our EHR to our outpatient clinics as well as to our outpatient laboratories. The current hospital has 300 beds, but we know that many more patients don't even grace the doors of the hospital because they are seen on the outpatient side. So for fiscal year 2018, we saw 1.5 million patients, and in fiscal year 19, that's projected to increase by 5 to 10% in patient volume. We have a general budget of $2.25 billion. So to implement one EHR in one outpatient clinic, we're looking at a cost of about $163,000. And to implement an entire hospital system, or in our case, organizational system, we're looking at $5 to $20 million. So we have a total of 15 outpatient clinics and 10 outpatient labs. So just doing the multiplication, that we're looking at the cost of an implementation of an EHR throughout the system being just over $4 million, $4,084,375. So role of public policy analysis and justification. So the justification of this, and in terms of the public is the delivery of care to the community, and also meaningful use criteria and the incentives that have come along with that. The relevance of the financial data. The financial data is relevant for decision making. It gives adequate, it gives the numbers so that we can make good decisions. It aids in determining value or perceived value. The financial data is going to help us understand and assess the feasibility of implementing an EHR across our system. And it also helps us to assess the risk. There are challenges here, obviously economically. It's expensive. We're looking at more than $4 million to start up. There could be hidden costs, and most certainly there are hidden costs. There could potentially be up to $35,000 a year in maintenance fees. And then we also have to understand that there's data migration costs that are potentially $30,000 to $50,000 that we need to take into consideration for this project. The incentives are we're going to have increased revenue related to satisfied patients. Currently, we're experiencing a lot of frustrated patients feeling like they have to hand carry paper. They feel like they repeat themselves a lot between one provider to another. So integrating this EHR is going to help streamline that, and we'll see greater satisfaction of patients, which will lead to hopefully more volume. We're going to see a reduction in duplication of exams because the information will be at the fingertips of the providers, and they won't be ordering duplicate exams. We're going to see an improved coordination of care, which is going to improve our quality, our delivery of care, and it's going to reduce costs the more coordinated the care is. And we're going to see timely care due to the timely reporting of results, whether that be lab results or imaging results. We're going to see better time with that. So in conclusion, in favor of an EHR implementation across the Central Coast Medical System, good management can lower the risks and the consequences. We cannot always project the benefit versus the risk, but with the data, the financial data, and the information that we have from the feedback from the community and from the patients, we can make a decision to look at the risk versus the benefit, even though we might not have even though it might cost a lot of money, we still can make a good decision based on the knowledge that we do have. And then we can see a risk overall reduced with the EHR implementation because we'll see an increase in patient safety and the financial benefits that was stated of more satisfied patients, less duplication of exams, and so on and so forth. So thank you very much for your attention, and hopefully we can pass this project.